For generations, Americans have been taught to fear a single molecule, cholesterol. From TV commercials to doctors' office brochures, the message has been simple and consistent: high cholesterol is a ticking time bomb, one that leads straight to heart attacks and strokes. The pharmaceutical industry has spent decades reinforcing this idea, and in the process, has earned billions through the widespread prescription of statin drugs. But according to Dr. Arthur Kensington, a 103-year-old heart surgeon from Crestview Health Center in Springfield, Illinois, this dominant narrative is not only misleading, but potentially harmful. With more than 50 years of medical practice behind him, Dr. Kensington believes our obsession with cholesterol has distracted us from the real culprits behind cardiovascular disease. Cholesterol, not a villain, but a vital player. Kensington begins by dismantling the myth that cholesterol is inherently dangerous. He reminds us that cholesterol is not a poison, but a vital component of human biology. Cholesterol is used by the body to produce hormones such as testosterone, estrogen, and cortisol, synthesize vitamin D, which supports bone health and immune function, build and maintain cell membranes, providing structure and stability, insulate nerves through the creation of myelin sheaths, ensuring smooth communication between brain and body. Without cholesterol, he emphasizes, life as we know it would not exist. Every cell in our body depends on it. To treat cholesterol as a toxic invader is to misunderstand its essential role in human health. He often explains this by pointing out that newborn babies, who are in a critical stage of growth and development, naturally have high cholesterol levels. If cholesterol were truly poisonous, human life would not begin with such abundance of it. The rise of statins and their hidden costs to push for statin drugs, according to Dr. Kensington, has been one of the most troubling developments in modern medicine. These medications are effective at reducing cholesterol levels, but that achievement, he argues, misses the point. Lowering cholesterol does not address the root causes of cardiovascular disease. Instead, it interferes with the body's natural production of a substance it desperately needs. Statins also come with significant side effects. Dr. Kensington has seen patients suffer from muscle pain and weakness, memory loss and cognitive decline or reduced cellular energy due to the suppression of CoQ10, a molecule critical for mitochondrial function, and increased risk of developing type 2 diabetes. For many, these trade-offs are not worth the supposed benefits. We've been treating a number instead of treating the patient, he says. That's not medicine, that's marketing. He also stresses that medicine should never adopt a one-size-fits-all mentality. Yet statins are often prescribed broadly, without full consideration of the patient's age, diet, family history, or genetic predispositions, shifting the goalposts, redefining normal cholesterol. Of the most troubling aspects of the cholesterol story, in Dr. Kensington's view, is the way medical institutions have repeatedly redefined what counts as a normal cholesterol level. He recalls a time when a total cholesterol level of 300 milligrams DL was considered within a healthy range. But in 1987, the National Cholesterol Education Program (NCEP) lowered the recommended threshold to under 200 mg DL virtually overnight. Millions of healthy Americans were reclassified as patients in need of treatment. This redefinition, which coincided with the launch of new statin medications, created an enormous new market for the pharmaceutical industry. Dr. Kensington finds the timing more than coincidental. It wasn't about saving lives, he insists. It was about selling pills. He also notes that the shifting definition has fueled unnecessary fear. Patients often come into his office distressed after receiving a cholesterol reading of 220 milligrams DL, convinced they are on the verge of a heart attack. Yet decades earlier, that same number would have been considered healthy. Fear, he believes, has become another product being sold. If not cholesterol, then what? If cholesterol is not the enemy, what does cause heart disease? Dr. Kensington points to a cluster of deeper, more complex factors: chronic inflammation, persistent inflammation, fueled by poor diet, smoking, lack of sleep, and chronic stress, damages blood vessels and sets the stage for plaque buildup, oxidative Stress, free radicals, unstable molecules generated by pollution, processed foods, and even chronic stress can damage LDL cholesterol, turning it into the truly harmful form that contributes to arterial plaque, blood sugar and insulin disorders. Uncontrolled blood sugar spikes and insulin resistance are central drivers of metabolic syndrome, a condition closely tied to heart disease. High blood pressure, hypertension places constant strain on the cardiovascular system, weakening arteries and promoting plaque formation. In short, cholesterol may be present at the crime scene, but it is not the murderer. Kensington sometimes compares cholesterol to firefighters at a burning building. Their presence does not mean they caused the fire, it means they are responding to damage already underway. Smarter tools for measuring risk to truly assess cardiovascular risk. Dr. Kensington recommends moving beyond total cholesterol. He suggests focusing on more precise metrics, such as APOB, LDL particle ratio. This test measures the number of LDL particles, which is more predictive of heart risk than total LDL cholesterol alone. Triglyceride to HDL ratio, a simple calculation that offers insights into insulin resistance and metabolic health. High sensitivity C-reactive protein HSCRP, a marker of inflammation that correlates strongly with cardiovascular risk. Blood sugar and blood pressure, simple, everyday measures that often reveal more than a cholesterol panel. By looking at the bigger picture, doctors can provide patients with a more accurate and actionable understanding of their health. This holistic view allows for preventive steps that target the actual causes of cardiovascular disease, not just one biomarker. The real prescription. Lifestyle medicine. The core of Dr. Kensington's message is a return to common sense. Pills alone will not save us. What truly prevents heart disease is a lifestyle built around the fundamentals of good health. Nutrition, a diet rich in fresh vegetables, fruits, legumes, and whole grains, with minimal processed foods and added sugars. Plant-based eating, he emphasizes, is naturally anti-inflammatory. Movement, regular exercise, even something as simple as a brisk 30-minute walk 3 or 4 times a week, dramatically improves cardiovascular health. Stress management, chronic stress triggers, inflammation and hormonal imbalances. Practices such as meditation, deep breathing, or simply spending time outdoors can lower stress. Sleep, restorative sleep is essential for healing, hormone balance, and blood pressure regulation. Avoiding toxins, steering clear of tobacco, excessive alcohol, and environmental toxins helps protect cardiovascular function. He reminds patients that longevity is not about living forever, but about living well. Even modest changes, switching from soda to water, replacing processed snacks with fruit, or adding to extra servings of vegetables a day can have an enormous impact over time. Don't chase a number, he advises. Address the root causes of disease, and your body will take care of itself. Conclusion. A century's perspective. At 103 years old, Dr. Arthur Kensington has lived long enough to see medical dogmas rise and fall. His career has taught him that science evolves, but human biology does not. Cholesterol, far from being a lethal enemy, is a life-sustaining molecule. Heart disease, meanwhile, is not the result of a single factor, but of a web of interconnected causes, most of which can be managed through lifestyle choices rather than pharmaceuticals. As Americans confront a future in which cardiovascular disease remains the nation's leading killer, Dr. Kensington's message is both urgent and hopeful. By shifting focus from cholesterol numbers to whole person health, we can move away from fear and profit-driven medicine and toward empowerment, prevention, and vitality.